Hello, everybody. My name is Dr. James Palmer, as you see down there in the corner. I am owner of Palmer Family Chiropractic over on Lawrence Avenue in the basement of a Richmond agency. We've been around since August of 2021, and I've been coming to the shelters and providing care complimentary to survivors and staff for a number of years. And so you'll be meeting me soon. And I just wanted to give you some background before I get there on chiropractic and why we get adjusted beyond pain. Because in our country, usually neck pain, back pain, or headache are the top three reasons that anybody comes to see a chiropractor. And, while we're very effective at getting help with those things, only about 10% of your nervous system feels pain. And so beyond that, 90% of your nervous system is controlling the function of your body for everything that's carried out in your body. And we're going to go through that, and I openly tell people, so I put my patients through this appointment that we're going to go through. And in my new patient process is 3 appointments. On the first day, we take x-rays. The second day, they get adjusted. The third day, we look at the x-rays that we took. And I put them through this brief class to show them what normal and abnormal x-rays look like. And that way, when they look at their own x-rays, they have a better understanding of what it is that they're looking for. And so before I started getting adjusted, I had 1 to 2 headaches a week. I had 2 to 3 nosebleeds per week. And I had frequent sicknesses and allergies that were so frequent, my parents thought I was just always sick. And so like in the spring and the weather, in the spring and the fall, the weather begins to change and the drainage of my nose would change colors. I would be getting sneezing and watery eyes and drainage in my nose. And my mom, trying to be a good parent, took me to the medical doctor, and I was getting things like nasal sprays and antibiotics. And some of the things that we didn't realize is that antibiotics were only good for bacterial infections, and that allergies certainly are not a bacterial infection. So it was wiping out all of the immune bacteria from my immune system. It was wiping all of that out and lowering my immune system and leading me to get sick every 4 to 6 weeks. The other thing we didn't realize was that nosebleeds, a long-term side effect of a nasal spray or nosebleeds. And so you combine with nosebleeds constantly and getting sick every 4 to 6 weeks. My parents thought I was always sick. And, you fast forward, I became a young adult and helped open the Walmart here in Jackson in my young 20s. And I worked with a lady, and her husband wasn't a chiropractor, but his brother is in Chicago. And we got to be friends. And, he said, you should go check out my brother and, check out his school and see what's going on. And I think you'll like it. And at first I didn't listen much to him. And then he piqued my interest and I went to go check him out. And 6 months later, I was going to school to become a chiropractor. Now, that may or may not be one of you guys. I hope maybe one day you do consider going to chiropractic college. But I have this nervous system chart that I want to walk through with you so that you guys do understand how your nervous system is directly responsible for your health. So as I mentioned to you, your brain, it controls everything. And it relies on messages that go from your brain down your nervous system, out your nerves to every organ, muscle, tissue, cell, everything in your body to make it work. And if we take the nerves that go to your heart and we cut the nerves that go to your heart obviously stops working. But if we take those same nerves and we pinch those same nerves that are controlling your heart, that's not going to allow your heart to work better. It's going to allow your heart to work worse. And, the result will be the same. It's just the amount of time that it will take, because your body can adapt better to pressure on a nerve than it can to a cut nerve. And so when you look here at this diagram of the nervous system, you can see that the nerves here at the top, and in general, you're going to find that the nerves in any part of the body or in the spine are going to go to that part of the body. So the ones in the neck are going to go to your head. The ones in your chest are going to go to the ones, or in your upper back are going to go to your chest. The ones in your low back you're going to find are going to go to your abdomen and into your legs. These ones here at the top of your head, they go back into your head. And it's very common to see when there's pressure up there, things like headaches or migraines, allergies, dizziness, vertigo. I've had some patients that say they hear their heart beating or water whooshing in their ear as a result of having pressure up there in the top of their head, as well as it does control these other glands here in your head. Now, these nerves here in the middle of your neck are going to go to your thyroid. So if you've ever heard of hypo or hyperthyroidism, one that works too little or too much, those nerves in the middle of your neck are what's controlling the function of your thyroid. And it does things for you like set your energy level for the day, make necessary hormones so you can sustain life, set your metabolism for the day. These nerves here in the base of your neck, C5, 6, 7, 8, and T1. These are going to be the nerves that are going to go down your in your shoulder down to your hand, forming what's known as the brachial plexus. And those same nerves, as well as the ones here in the upper back, T1 through 5, are going to help control your heart and your lung function. So if you ever heard of when someone gets a heart attack, their whole arm will go numb. When you have an injury that serious, your body will recruit all the nerve fibers in that area, let you know you have a serious issue and to get some medical attention very soon. Moving down into the middle of your back, T6, 7, 8, and T9 are going to go into things like your abdominal cavity, things like your spleen and your liver and gallbladder, your pancreas, the top half of your stomach. Moving down to T9, 10, 11, and 12 are going to go to the lower half of your stomach, your kidneys and your adrenals. Moving down into your lumbar spine, L1 through L5 is going to go through to things like your bladder, prostate for us males, the small and large intestine, male and female reproductive organs. And those bottom 5 nerves in your low back make up what's known as the sciatic nerve, which goes into your legs down to your feet. Now, this is the function chart. This is a stat I always love to share during doctor's report, where if you think of your health in terms of function, where 0% function is death and 100% function is perfect health. And when usually you're at 100% health, that's as close to where we're, born as humanly possible. And usually at that point in life, you don't need any drugs or imaging or procedures or too many, and the issue becomes that everything that we do in life starts to take us towards this 0% mark. For instance, when a child is born, their neck will stretch up to 2 inches before their ligaments tear, which will be their first subluxation, which is when their spine misaligns and puts pressure on the nervous system that sometimes causes pain, but not always. Because again, only 10% of your nervous system feels pain. So often all of the pulling to get them out of mom can become their first misalignment here at the top of their neck or in their neck somewhere. And then they get a little bit older and they learn to walk. And the average child will fall 3,000 times learning to walk. And they get a little bit older, and then we get on bikes and playground equipment and take falls. And then we get a little bit older, and then we sit in a desk for 13 years in poor posture to get high school diplomas. And then we learn to drive, and we're driving in poor posture, and we get in car accidents, and we get in sports, and we get take injuries in sports, and we sleep in poor positions. And then we look at technology, and and we're driving. Like, we do all these things that wreck our spinal health. And on average, as you see here, you don't get your very first symptom until you're here, where you've already lost 40% of the function of the nerve. So by the time that you get your first headache, back pain, depression, whatever it is, you're already operating in the lower 60% of this function chart. And you can treat chiropractic. I always tell my patients, you can treat chiropractic like you treat a medication, where you get adjusted when you have pain and a symptom, and you don't when you don't. But if you come in and get just 1 or 2 adjustments and get just out of pain, the problem still remains there, and then the symptom will return no matter how long it takes. Because if you don't fix the problem, the symptom returns. But before you know it, if you approach your health like that with chiropractic, you essentially just treat chiropractic like a medication, and you essentially circle this 60%, and you manage pain and symptoms, and you never fix the issue, which is what we aim to do in our office: get people as close to that 100% as humanly possible, and then give them education on reasons why they should maintain it. But not everyone is of that. Not everyone does. I'll be honest with you. So this is our first X-ray here. You can see the person is facing that direction, and you can see the back of the skull here, the teeth. A perfect 45-degree curve. So as you remember from that nerve chart, you need to have 3 45-degree curves all from the side of your spine. And you can see that one looks just like a banana there in your neck. That's exactly what you want to see when you look at X-rays of your spine the next time you do. And when you look at here, you can see that the bones here are nice and smooth. There's no bone spurs that occurred. The disc spaces are nice and fat and wide open, which is what you want to see. Now, the discs don't actually feel anything. But as you can see here on my dry spine, that nerve comes out here right behind the disc. And so let's say you're 10 years old and you fall off your bike and you injure your hips, and your hips, you come inside and your hips are injured. And your mom says, "I'm sorry, honey, take a minute and walk it off, have a seat, go back on out and play with your friends." And you do, but you had an actual injury that stayed there. And you're like, you know what? I got to start taking some ibuprofen for this. This is starting to bug me. And turns out you weren't deficient in ibuprofen, so the pain kept coming back. You ever had that happen where you took ibuprofen, but the next day it came back because you're not deficient in ibuprofen, right? And then so you go back to your medical doctor, or you go to your medical doctor and say, "Hey doc, what can you do for me to help?" And he says, "You know what? I'll tell you what. We'll give you some anti-inflammatories, some muscle relaxers, some painkillers, and see how you do with that." You go home and you take those things. You come back and see him. And you say, "Hey doc, those things they help take the edge off when the pain got bad, but I still feel it day to day, and I want to do something about it." And he says, "Okay, well, I'll tell you what we're going to do. We're going to send you to PT." Now, PT will be good because PT is going to strengthen up the weakened muscles in that area. But if you don't have a weak muscular, if your muscles aren't weak in that area, then you're only going to get so far because it's not addressing the problem. And you go back and see him and you say, "Hey doc, PT was all right, but I still feel it, man. What can we do?" And he says, "I'll tell you what we're going to do. We're going to give you a shot." Now, a steroid injection is not going to do anything to fix the issue, but it'll help you not feel the pain so that you can work through it. You can work out through it, go through your day, but you essentially make it worse. Kind of like if you were running and you sprained an ankle and you took ibuprofen and you kept running. And at the end of the night, the pain would be more, the swelling be more, the fluid be more, take longer to heal, like all those things. And it's the same thing with those shots. Now, the thing with the shots is the American Medical Association only ever recommends you get 3 of those shots in your lifetime because they speed up the arthritic and the degenerative process of the joints, and essentially set you up for surgery a little bit sooner, which is the next step. You go back and see your doctor and you say, "Hey doc, how many more of these shots do I need before I'm fixed?" And he says, "Well, I'll tell you what, send you out to a surgeon, and it takes 25,000 bad motions to herniate a disc. And you can clip it, cage it, fuse it, burn it. You can do whatever you like. But if you don't take care of the cause of the problem, eventually the symptom comes back." So the reason why Superman is in here, because I usually tell my patients that we talk about how, how all of the motion of the body relies on the nervous system, from the message coming from the brain down the spinal cord, in order to make your hands move, your legs move, and all of that to happen. And I say the most notable example of that's Christopher Reeve, who played Superman on TV in the late 70s and early 80s. And for those of you who don't know who he was, he played Superman, but he was injured, and he was playing polo on horseback, was bucked off of the horse, hit his chin, where his chin went up into extension like this, and he broke that top bone in his spine here, the one underneath his skull. And after that, he was a quadriplegic, where none of his arms or legs moved. And he stayed like that for 9 years. Now, on his MRI report, it said that the damage that was done to his spinal cord was small enough you could cover that up with the width of a pinky, but it was powerful enough it shut down his entire body. And he's dead now. In the back of his book is his autopsy report. And it says that in the 9 years he spent in that chair, his body aged more than 30 years. Which shows you that when you have pressure to your nervous system or chronic pain, that this shrinks the amount of gray matter in your nervous system, which is what sends signals quick. Like if you touch a hot stove, you pull your hand back quick, it shrinks that amount of nervous system and makes you feel 10 to 20 years older than your actual age. So if you've ever thought that to yourself, it's been backed up in the literature. Now, as I mentioned, this is what a normal x-ray looks like. You see there's this space here in the back of the skull, which is what you want to see, because the nerves we've been talking about come out here right behind the bones, and you can see how much space that those have there at the top of the spine. This is another normal spine. The person's facing the opposite direction, and you can see there's a cadaver here on the right-hand side, or a half section. When you look at that, you can see that the brown spots, the darker brown spots there, those are the bones. And then that the lighter pads in between the dark spots, those are the disc spaces. And you can see how fat and healthy those discs are. Here in the middle, you can see that the spinal cord is running through the middle of that spinal canal, and there's 2 pathways on both sides. And that's important because there's 2, your brain is bathed in a fluid known as CSF for short, and it has to get down to the rest of your spinal cord in order for you to maintain life or you die. So you can see how easily that happens at that particular example there. Now, this is phase 1. There's 4 phases of degeneration. This happens to be a loss of curve at 100%. Now, anytime that you lose more than 50% of the curve in your spine, you can see here in the middle of the cadaver there at like C3 and 4 that the spinal cord has thinned and the pathways have thinned with it, make it harder to get that spinal fluid from the brain down to the spinal cord. When you look at this cadaver, or the X-ray on the left there at C3 and 4, you can see here in this posterior aspect, or the right here between the lines here in the back, that there it's just more white and cloudy there than it is in those lower 2 or 3 levels. It's not real crisp or sharp. That's arthritis that has started there, active arthritis. But the good news is when you're in phase 1, it's classified by a loss of curve, and it's 100% reversible. Now, phase 2 is also up to 100% reversible. This is what's known as early stage arthritis. If you guys have ever heard the term of early stage arthritis, you can see when you look at those joints there in the back that they're just a little bit more white, cloudy, fuzzy, not as crisp or sharp. Down here at C6, we're getting a bone spur, and that's also known as disc degeneration, or a degenerative disc disease. Now, anytime that you get disc degeneration, it won't just happen to the front, but it also happens in the back. And you can see there on the cadaver at C5, it's pinching on the spinal cord, and that's what's known as spinal stenosis. Spinal stenosis is when you do get pinching of the spinal cord. Now, you do get stenosis when you have a misalignment, like if you get a pain in your back. That's a segmental, where the hole is closed down and put pressure on the nerve. But when it closes, when you have spinal stenosis, it's closed down on the cord. It's more severe and usually leads to more severe symptoms. I usually tell people in the doctor's report that, it's usually, you can see it like with, you can assume a person has it if they like to lean all the time, like a person that wants to lean on a grocery cart a lot through the grocery store, things like that. This is phase 3. This is what's known medically as late stage arthritis. You can see there's multiple levels of disc degeneration and bone spurring in this X-ray example on the left. When you look at the joints there behind the bones, the squares, you can see that there's more advanced arthritis there through those joints, to the point where they're starting to want to fuse together and getting very limited ranges of motion through there. When you look at the MRI, or the cadaver here, you can see that those lower 3 discs are very dehydrated and very worn out. Now, in the office, we do warm-up exercises to help rehydrate discs. But you can see that that spinal cord is very cramped, becoming pretty dependent on the motion of that person's head and neck to get the fluid down to the rest of their spine. But when you're that subluxated and locked up, you don't move your head and neck real well. Now, this is phase 4. Phase 4 is the only thing that's not correctable in the area of interest. When you look at the X-ray here on the left, you can see this lower section down here in C6 and C7. Those are fused together. Now, no matter if a fusion's natural or surgical, this one's natural. A fusion, the areas that are above and below the fusion become more important because they start to make up for the loss of motion that happens at that level. And when I first moved to Jackson, I saw this about 3 times my first 5 weeks in practice. That wasn't a natural fusion, it was degenerative. And when I saw those, I noticed some similarities in those cases, that the person had a considerable amount of pain. They were on at least 10 medications, and there was a reason that they allowed their spine to go that bad, whether it was, be with friends, family, work, serve God, party. It was like, when you lose your health, that all goes out the window until you can get your health back and be in a place again where you can serve. And these are a few X-ray examples here. The left one is the one that you've seen a few times already here for normal, for reference. The middle one here is a 55-year-old man named Dan that I took care of in Illinois, and he didn't have any pain when he presented for care. And he also was not on any medication, but he worked for Nestle and would stock shelves and needed to be able to keep up with the younger guys. And they were basically finishing their route before he was, and he didn't like it. And he just said, "Doc, I need to be able to keep up." Now, when you look at his X-ray, you can see that he's got a decent curve here in his neck, but in those lower 3 segments there, he's got those discs that are touching arthritis in the base of his neck there. That's phase 2. Now, this far right X-ray, this is Sarah, a 17-year-old patient I took care of in Illinois that had migraines when she first presented for care, and she was on 4 medications. One of the medications were to prevent the headaches and migraines that she got. And when you look at that top bone in her spine, look at how flat that is in comparison to where it needs to be. I mean, pretty flat. You can see that it's pinching down on those top nerves there pretty good, and good explanation on why she's getting those headaches and migraines, in addition to the fact that she has lost all of the curve in her neck. That's more than a 100% loss of curve in her neck. Look like it's bending the opposite direction of those other 2, the way it needs to be. She started under care, and this was her original X-ray that you guys saw. 7 degrees to be exact, in the wrong direction. And this was her progress x-ray 9 weeks into care, where she was having 1 to 2 headaches a week and 1 to 2 migraines a month. And this was her most recent progress x-ray that she had taken up until I had left Illinois. And I always tell my patients, in order for her to get these results, she started multiple times a week in the office, and she was doing things at home. The secret sauce with chiropractic is when you have a new injury, pain, you're sick, to get more adjustments in a short amount of time to get through it as quick as you can. So the average symptomatic adult in my office starts between 2 to 4 times a week. And we also have them do things at home for a couple of reasons. Number one, about 40% of the results that a person can get will come from things that they don't do in the office. Number two, I find more and more patients want things that they can do to empower themselves to take control of their health. And the third reason is because, healthy habits require daily maintenance, kind of like anything else, brushing teeth, washing yourself, anything. So low back x-ray here. Remember, perfectly straight, hips level. Two things that x-ray isn't. This is a little 6-year-old girl named Jane who got an x-ray because her mom was under care. And come to find out, Jane had scoliosis and that no one knew about. And when we x-rayed her, this is what we saw: an 11 millimeter drop on her left hip with a 15-degree curve here in her low back and a compensating curve there in the mid back. At 6 years old, that's scoliosis. And she didn't have any pain from it. Often when I ask, what do you think she got? People say indigestion, low back pain. She didn't have one symptom from this. She's 6 years old. And we showed this to mom, and we told her, we said, hey, this is scoliosis, but she's watching, wait till she gets to 20 degrees. And when she gets to 20 degrees in the medical system, they're going to want to brace her. And if I'm being honest with you, the Boston braces, they suck for a number of reasons. But the main one is because they squeeze the person and allow the curve to grow. And who wants their curve to continue to grow if you're trying to do something to prevent it, right? So I told her, I said, in our mind, it makes more sense to straighten that spine as much as we can in between growth spurts, because girls are 8 times more likely to get scoliosis than boys for reasons unknown. And anytime she grows, that curve is likely to grow with her. Mom said, I agree. Let's start her under care. And we did. And 4 months later, this was little Jane's spine. You can see her spine is straightened out quite a bit. Hips are much more level. I always tell my patients, I say, the cool thing about this is that medically, that's no pain to no pain. So we have to just wonder what we helped her prevent on the back end of care there. But if I were to ask you again, who's the healthier person? I mean, no doubt about it that, you would say the person on the right, but that's because that your structure protects your nervous system, which controls the function of your body. Therefore, structure equals function equals health. Now, these next couple of x-rays are from Jackson, me practicing in Jackson. This was a 4-year-old little girl named Sophia who came to see me on referral from her grandparents. And her grandparents came on referral, but they didn't want to be under care with me, but they had exhausted all the options they had for what they had going on. Grandmother had occipital neuralgia very bad when we first met, to the point that she was getting 35 injections into her head 4 times a year between nerve blocks and Botox. Can you imagine getting injected into your head all around your cranium 35 times and having to do that 4 times a year to get a few days of relief? Her grandfather was the definition of a train wreck. He is a bass player. And when we met, he was getting numb and tingly hands and legs. He couldn't turn his head to the right. In fact, I had to bring my chair more to the center in front of him so that we could do our consultation. He was sweating profusely, lots of low back pain. I mean, as I said, could you imagine trying to play bass and your hands and your legs are going numb on you? It was miserable for him. And after they had been under care for me for about 2 to 3 months, grandma asked, she said, hey, I have a question. My 4-year-old granddaughter has a problem wetting herself. Can you help her? And I said, well, 4 years old, nighttime wetting, that's pretty common. She said, well, let me stop you there, because she does that too. But if she's at school and gets the urge to use the bathroom and doesn't jump up and go right away, she wets herself in front of everybody. And my heart broke for that little girl, because I have a daughter as well. And I said, well, bring her in, because the only thing that I know is that the nerves that control the bladder are in the low back and in the pelvis. And when you look there, you can see she's got this 13-degree curve here in her low back, 15-degree compensating curve there in the upper back. Her hips are pretty level. But when you look at the left side of her pelvis, you can see there's this joint with a pretty big gap there that's not there on the opposite side. And, those nerves help control organs down there. And I adjusted her once, and she did a lot better that night and the next couple of days at school. And mom and grandma thought that was pretty cool and said, hey, let's do some more. And 18 visits later, 3 months, this was little Sophia's spine. You can see her hips have leveled right out. Spine is much straighter. This gap is closed up in that joint, and she regained the function back of her bladder. Now, this is our last x-ray. This is the mother of a friend and a patient that I went to high school with by the name. Her name is Corey. His name is Robert. And when Robert came to see me, it was 2 weeks after I opened in August of 2021, and he was already under chiropractic care. And he said, I get genetic migraines. And I said, well, that's really interesting, friend, because that's not how that works, but I'm really interested. So tell me, keep going. And he said, well, my mom gets these headaches, and anytime she got them, I would be her gopher. I'd go get her water, a washcloth, a fan, whatever she needed, I would help her. And now I get the same exact migraines. I can tell you when we're going to get weather 2 days before, and now I get a hangover with that migraine after. They're debilitating. How can you help me? Well, he started under care with me, and we got his migraines down considerably. And after he had been under care with me for about a year, mom came in and wanted to know if we could help her with hers. And when you look there at the top part of her ear, you can see she's got a piercing for her headaches and migraines. And when we consulted, she said, yeah, Robert would help me. Yeah, that's right. But the part he probably didn't know to tell you is that anytime I got neck pain or a headache or a migraine, I'd crack my own neck, or I'd let one of my boyfriends crack my neck for me. And I put this x-ray in here because of all of the social media, the chiros on social media showing people how to do weird manipulations on people's spines or on their own. And I just want to tell you that, when you go and you grab your chin like this and you crack your neck like this, you don't know what bone moved and if it was helpful. But I can tell you that the areas of the spine that already move well are the ones that you're getting to move more when you do that. And that's producing the sound for you. But the areas of the spine that you weren't wanting to get to move, they stay stuck. And that's why you have to do this for 5 or 10 minutes after, because you're trying to get that spot to loosen up, but you can't get it. Now, when you do this, and you might get that little sting, or you get adjusted and it might sting a little bit, but it feels better really right away. That's because your body releases a natural painkiller called endorphins. And so that's why it stings a little bit, but it comes down. Now, when I was in chiropractic college, we had to learn where we were at upon palpation, touching a person's spine, and know the displane line angle of the part of the spine that we were in, so that we didn't do irreversible damage to a person's spine, like what you see here with Corey. I would not want to see that on anyone's x-ray, because that's irreversible damage that cannot be undone and causes limited ranges of motion. And so now when you see that on somebody, you can explain to them, what they're doing, why it's bad, and why they should stop, and they need to go see a chiropractor. So with that being said, guys, that's my last x-ray. I'll be showing up real soon. We're going to get some adjustments going. If you have any questions, feel free to ask me when I show up. I'd love to answer your questions because it helps everybody learn. So with that being said, take care. God bless. See you very soon.